I'm now joined by Dr. Nicholas Wareham, recipient of the 2021 Kelly West Award for Outstanding Achievement in Epidemiology. Thank you so much for being here.
Thank you very much for having me.
What first got you interested in understanding the etiology of diabetes and other metabolic diseases?
I've been involved in diabetes clinically in the late 80s, but encountered research in the early 90s and was really fascinated by what was it about physical inactivity that was associated with diabetes and gave people increased risk, and really identifying the key elements so that we could actually inform prevention.
What were some of your most rewarding early accomplishments?
Well, I was very fortunate. I worked as part of a cohort study in the UK in the early 90s and was able to employ an objective method to separate out the effects of physical activity and fitness and really work out that it was what we should be striving for is to try and increase overall physical activity in everyone.
How have you seen our understanding of the role of lifestyle exposure and gene-environment interactions change over the years?
I think one of the key things I learned from that early study that this issue is one that really affects everyone. There isn't a small subgroup of people in the population who are inactive. It's actually an issue that affects the whole society. So you can see diabetes as a clinical manifestation of a pathophysiological problem, or you can see it as a public health manifestation of a societal problem. And I think we've moved away from thinking about the problem as being one of lifestyle, which intrinsically got a sense that there was an issue of choice, to thinking about behaviors in a broader sense and trying to work out what the key determinants of those behaviors are, because they're often beyond the control of individuals.
And how has this impacted the way the field treats people living with diabetes now?
Well, I think that sort of thinking has moved us away from focusing our attention solely on the individuals who are at risk to thinking about whole societies and how we can change the nature of society, how we live our lives, how we're physically active in everyday aspects of what we do, and how we eat and behave such that our diabetes risk is altered. So it's moved it from thinking about individuals to populations.
Today, you're working to prevent diabetes through public policy in the UK. What's been the journey there?
Well, I think that it was previously been suggested in the past that it was possible to prevent diseases like diabetes by small changes that were impacted on by lots of people. But that was a theoretical proposition. And since 2008, we've been involved in trying to amass the evidence for what works and what doesn't work. And I think the key message is there's not a single solution. It's a multitude of small things, all of which add up. So the sugar tax in the UK, for example, will probably make a small difference. But that difference can be quantified, but by itself it won't be enough. But put together with other changes, those will amass and eventually we will get impact on diabetes risk.
Looking ahead, do you see the chance for positive change in the future?
I do, but it really requires us to combine the things that we know that work, like individual lifestyle intervention trials and the rollout of that into the general public, but also alongside that have better public policy that supports all of us engaging in better behaviors.
Share with us now a little bit about your talk at the meeting. What can attendees expect?
In my talk at the meeting really traces the change in our knowledge about risk factors and type 2 diabetes, harking back to early research in the 1970s, which really was qualitative and established what the risk factors for diabetes were. And over the last 40 years, we and others have assembled evidence that goes into much greater depth about what those relationships are, how quantitative they are, and whether or not they are causal. And it's this that allows that epidemiological knowledge to be translated into preventive action.
Thanks again for joining us and enjoy the rest of the meeting.
Thank you.